So my name is Carol, and in honor of Diabetes Month, which is in November, I wanted to do kind of a quick tutorial about diabetes for the non-diabetic. There are many varieties of diabetes, probably more than I'm going to cover in this video, but in addition to the various types of diabetes mellitus, which is what this video is going to mainly focus on, there are two main branches when people say diabetes that are being referred to. One is diabetes insipidus, the other is diabetes mellitus, which I just referred to. Diabetes insipidus is basically where people urinate a lot more than the average bear, so to speak. I read somewhere, I think it was like 16 liters per day, but basically what can happen with diabetes insipidus is the person will become severely dehydrated and they'll have issues with electrolyte balance and low blood pressure, etc., and oftentimes they end up being hospitalized because of the excessive urination and the inability to kind of process water correctly. So sometimes it's referred to as water diabetes. I don't know if that's 100% accurate to refer to it that way or not. If someone has diabetes insipidus, if you could let me know, but colloquially sometimes it's called that. I'm a little hesitant to call it that simply because I suspect it might be kind of like when people refer to diabetes mellitus and all of its various assorted shapes and sizes as sugar diabetes, which is one of my pet peeves because sugar has nothing to do with becoming diabetic. If you wanted to, you could go sit at your table and eat an entire multi-pound bag of sugar, and it will not make you diabetic. Saying sugar diabetes is a bit like saying dust asthma. Yes, dust sometimes triggers asthma attacks. It does for me. But exposure to dust does not make someone asthmatic. Otherwise, everyone on the planet would basically be asthmatic. At least everyone in the Western world would be asthmatic. But we know that's not the case. So, sugar diabetes is just kind of incorrect for that reason. There are a lot of factors that contribute to becoming diabetic. Consumption of sugar is not one of them. So let's break down the various assorted types of diabetes mellitus. There's type 1.5, which is not as well known. It's only becoming recognized in medical field now. Gestational diabetes, type 2, and type 1. And I'll go through those in the order that I just mentioned. Type 1.5, as I said, it's not quite as common. It's not as recognized. But basically, from what I understand, and again, I know less about this than I do diabetes insipidus, so excuse my ignorance, but it's basically when a person develops resistance to insulin like they do in type 2, and also they have an autoimmune response that results in their insulin producing cells getting destroyed like in type 1. It's usually adult onset. Again, I could be wrong about that, but that's kind of 1.5 in a nutshell. Gestational diabetes, as its name indicates, basically comes about when a woman is pregnant. As you know, when women get pregnant, a lot of wild and crazy things are going on with their bodies because they're growing another human inside them. So a lot of physiological changes occur, and sometimes around the 24th week, what happens is their ability to produce or respond to insulin gets affected, so they'll have to monitor their blood sugars and oftentimes take insulin injections for the remainder of their pregnancy. Now, gestational diabetes does not mean necessarily that the woman's going to be diabetic after the baby is born. However, it can lead to a 5 to 10% increased likelihood of developing type 2 later in life. More about that later. But yeah, that's basically gestational diabetes in a nutshell. Again, doesn't necessarily mean that a woman's always going to be diabetic, but it just kind of happens as a result of all the changes that are going on to her body when she's pregnant. Type 2, as I kind of briefly alluded to during the reference to type 1.5, is basically where a person becomes resistant to insulin. Now, there are a lot of factors that lead someone to becoming type 2. There's a genetic component. There's, as I've indicated, the increased likelihood when a person has gestational diabetes. there's also a correspondence between being overweight and developing type 2. So now I understand that there are a lot of reasons that people gain weight, and some of them are beyond the person's control, but it's often stereotypically viewed as a lifestyle illness. So, type 2 diabetes, again, there's a lot of different factors that can contribute to it. It's treated sometimes with oral medication, sometimes with insulin, depending on how far it progresses. But it can also be treated with diet and exercise. And there have been cases where it goes into remission if a person loses enough weight and monitors their diet and exercise enough. And so oftentimes when you read articles about, oh, there's a cure for diabetes, it's referencing type 2 and successes in treating that. And it has nothing to do with type 1, just type 2. That's a point of annoyance that I'm going to mention later. But type 1, which is the type that I have, is insulin dependent. It used to be referred to as juvenile diabetes because it was nearly always diagnosed when a person was a child. It can be diagnosed as early as infancy on. In my case, I was diagnosed at the age of 12. As with type 2, there is a genetic component to it. There's also some environmental factors. Specifically with the environmental factors, it's often a response to a virus, wherein the immune system gets all wild and crazy when it's fighting something off like the flu or some other serious viral infection and decides, hey, let's keep going, let's keep attacking stuff, and goes on and attacks the insulin-producing cells. That's kind of what happened in my case. I don't have anyone I'm related to who's type 1 diabetic. My grandfather was type 2, but as far as type 1 goes, as far as I know, I'm the only one in the family. Woo. So that was kind of it for me. But yeah, I just want to mention briefly some things that you might want to keep in mind when you're talking about diabetics or when you're talking to diabetics. First of all, if you're going to share an article with a diabetic about a possible cure, make sure that it's corresponding to their particular type of diabetes. I cannot tell you how many times people have shared articles with me about, oh, isn't this wonderful? They're curing diabetes, and it's type 2. And if the person had just taken maybe a couple minutes to look at the article, they would have realized, oh, it's type 2. Carol has type 1. It doesn't apply to her. So that kind of gets under my skin. The other one is, I'll often meet people who say, oh, I have a grandmother who's diabetic, and then they just change the subject, and they don't give me a chance to respond. They don't ask about the type of diabetes they have. And I get that people want to have connections with others. I understand. I do it too. You meet someone on the street who has, say, the same color eyes as you. It's, oh, that's neat. We have that in common. But quite honestly, your grandmother having diabetes has nothing to do with you in the same way that my being type 1 diabetic has to do with me. Now, the proper way to address someone who's diabetic, if you want to bring up a relative who's diabetic, rather than kind of making it about you, which is how that comes across, by the way, is, hey, I understand there's various types of diabetes. My grandmother has type 1 or my grandmother has type 2. What type do you have? Because that lets the diabetic know, okay, well, this person knows at least a little bit about the varieties of diabetes. They've acknowledged that I might have a different type to what their relative has, and it kind of puts the person at ease, and they're more likely to develop a conversation with you and, get to know you a little bit more on that point. So just bear that in mind. Also for type 1 diabetics, and I'm going to link below to 10 things that diabetics are tired of hearing, an article, blog post that I wrote. A lot of type 1 diabetics have put these out, the top whatever things that type 1 diabetics are tired of hearing. Just go to YouTube, type that in, and you will get countless videos. It's like every diabetic under the age of 30 has put one of those out. One of the top ones is being compared to type 2 diabetics, because as I've said, there is that stereotype that type 2 diabetics kind of had it coming because they were overweight. I know that's terrible. I'm sorry, but that is the stereotype that's out there, and there's nothing type 1 diabetics can do to prevent their illness. So in a way, it's it would be a bit like me going up to someone who has breast cancer and saying, oh, I know what you're going through because my grandfather had lung cancer. Yes, there are types of lung cancer that are not caused by the person themselves smoking, but like in my grandfather's case, he smoked my paternal grandfather's case, my maternal grandfather was the one who had diabetes, but my paternal grandfather was a multi-pack-a-day smoker for most of his life, so you can see why that would kind of irritate type 1 diabetics a little bit. So just be aware when you're talking to diabetics, we all have different varieties. Well, I mean, there's a limited selection, but the chances are we're not necessarily going to have the same type of diabetes that your relative has, so just bear that in mind. As I've said, if you want to bring up your relative who has diabetes, great, but let the diabetic know what type your relative has, and then inquire what type they have. I'm always, frankly, I'm always interested in meeting people who have older relatives who were type 1 diabetic. I used to live down the street from a guy who was a grandfather who had type 1 diabetes, and it's fascinating for me to get to know a little bit more about his childhood, because when he was diagnosed, yes, they had insulin, but glucose monitoring was strictly done through the urine, which wasn't nearly as accurate as monitoring it through the blood. And it's just kind of fascinating for me to see how the disease has progressed, how the treatment options have progressed. So just bear that in mind if you're talking to a diabetic. Again, I don't want to hurt anyone's feelings or anything, but that is kind of a minor sort of annoyance. And as I said, this is mostly an educational video, so that was also why I decided to bring that up. But again, there's multiple types of diabetes. Go online, type in diabetes, especially diabetes mellitus, and look at the long list and get to know their symptoms and treatments and stuff, and learn more about it. So yeah, that's my little 2 cents on Diabetes Month. So hope everyone's having a great day. Take care. Bye.